Well, some new recommendations for parents of infants. Pediatricians say newborns should sleep in the same room as their parents to reduce the risk of sudden infant death syndrome. The guidelines recommend sleeping in the same room for at least 6 months, maybe even longer. And doctors say babies should be in a separate crib. Infants should be placed on their backs on a firm surface with tight sheets. Those cribs, again, should be empty. Again, babies should sleep on a separate surface from their parents. For more on these new guidelines, let's bring in Dr. Lori Feldman-Winter, a co-author of the American Academy of Pediatrics Guidelines and a pediatrics researcher at Cooper Medical School of Rowan University in Camden, New Jersey. It's nice to have you, doctor, on the program. I'm sure our viewers have heard about these new guidelines over the last 24 hours, specifically the big headline about having your infant in the same room with you for at least 6 months, maybe even for the first year. I've heard very few news reports, though, explain the why researchers think this is a good idea. Can you tell our viewers why that's recommended?
Yes, absolutely, and thank you for having me. So we know that sleep arrangement where we recommend room sharing but not bed sharing can reduce the risk of SIDS by as much as 50%. And we think some of the reason why, and no one has proven exactly what this reason is that the mothers and their infants actually have a different sleep state when they're together. So they may sleep a little less soundly, and just that kind of sleep architecture may actually be protective against a really sound sleep that may be one of the risk factors for having SIDS. In addition, we know that room sharing facilitates continued breastfeeding, and breastfeeding, we know, is one of the recommendations that dramatically reduces the risk of SIDS. In fact, the more a mother breastfeeds, the longer she breastfeeds, the reductions can be as much as 70%.
We're seeing all these cute images of newborn babies on the screen, and I'm sure our viewers that are parents, all you want to do is protect your children, and so you'll do anything that you can. And I'm just wondering if the recommendation is to sleep next to your child during the night. Is that the same recommendation for nap time as well?
Yes, so we don't really distinguish the sleep. We say that infants should be placed supine or back to sleep for every sleep. And in fact, when the recommendations were first made, this was being done at the nighttime sleep, but we started seeing that many of the residual cases of SIDS were occurring during daytime and in daycare settings and other settings or childcare settings. And so the recommendations about sleep are really for sleep throughout the day. And so if a baby is placed to sleep, they should be placed in an environment that is sharing a room with the adult, but not sharing the same sleep surface. A particularly hazardous arrangement is when a baby is in the hands of an adult and then the adult and the baby fall asleep on a couch or a sofa or an armchair. And so we don't recommend that sleep arrangement in particular for infants.
And as a mom of a 6-month-old, it's certainly easy to do that, especially when you're so sleep deprived and you're just, you're trying to rock that baby to sleep. It is easy to do that. So it's a good reminder. As a parent, though, you're told so many different things over the years. 20 years ago, you're told to put the baby on the stomach. Now we're told to put the baby on the back, but that if the baby slips, turns over on their stomach, to leave them because it's okay. And so it leads to kind of a natural question about the research, doctor, I'm hoping that you can address. Because again, we just want the best thing for our kids, but can we really trust this research when so much has changed over the last several decades about what to do with our children?
So one of the new things that we did for this statement was actually identify what the levels of evidence are. And we categorize that level of evidence based on the kinds of studies that we used. We have over 400 publications just alone in the technical report that really give us the information. Many of the studies are really combinations of studies, or what we call meta-analyses. So they're really groups of studies that are all pooled together where we can really have a higher level of evidence to make these recommendations.
And a quick final question, what do you think about wearable technology? Because that's the new thing for infants these days. You could put something on them that they can wear that monitors their breathing or their heart rate. What do you think about that?
Yeah, so we don't recommend the use of monitors or really any other devices for that matter that are marketed to reduce the risk of SIDS. And in fact, using these devices as a method to maybe have a separate room for the baby to sleep is not protective. So we can't issue any recommendations regarding devices that are marketed to reduce the risk of SIDS because they haven't been shown to do that.
Doctor, great to have you on the program. We appreciate it very much.
Thank you.